Hello and good afternoon. Thank you for joining us. I am Mark Zeza, Director of Policy and Research at the New York State Health Foundation. For today's conversation, we'll be focusing on mental health of New Yorkers during the coronavirus pandemic and answering questions such as, are New Yorkers feeling more anxiety and depression than normal? And how can we improve people's mental health during the pandemic? These topics are all the more important as it appears as if we are experiencing another uptick in the incidence of COVID. But before we jump into the conversation, let me review a few housekeeping items. We'll be recording this webinar. Also, a recap with a link to the recording and other materials will be circulated afterwards. Video and audio are disabled for attendees, but we invite you to use the chat box throughout the event to share questions. I will try to work in the questions from the audience throughout the discussion, so please do not hesitate to submit them at any time. Now I'd like to introduce our speakers today. First up is a colleague of mine at the New York State Health Foundation, Sophie Wheelock. Sophie is a policy and research associate and is the lead author of a series of reports on the experiences of New Yorkers during the pandemic. You can find these reports on the New York State Health Foundation website. The most recent in that series was published just a couple weeks ago and focuses on mental health trends. A link to that report should be in your invitations for this event. I will also ask Sophie to share some of the key results in the report with us shortly. We're also very fortunate and excited to be joined by Lisa First, who is the Chief Program Officer at Vibrant Emotional Health. Some of you may also know Vibrant by a different name, as it was once formerly known as the Mental Health Association for New York City. In her role, Lisa not only works with one of the leading organizations helping to improve the mental health of individual New Yorkers, but also has a great understanding of the types of strategies and policies that can be implemented to address these issues on a broader scale. Thank you so much to both of you for joining us. I know there will be a lot of questions and there's not a lot of time. We plan to end by 1:15. So let's jump right into the discussion. Sophie, can you start us off with a brief overview of the survey you used for the mental health analysis and why you conducted the research?
Thanks for that introduction, Mark. So at the start of the pandemic, we were interested at the foundation of studying the secondary effects of the pandemic, beyond just incidents of coronavirus infections themselves, to see how the pandemic and living through it was really impacting New Yorkers' daily experiences. And that includes mental health, especially as people were living through the fear of a coronavirus pandemic and isolating at home. And we're really fortunate that at the start of the pandemic, the US Census Bureau actually created a new data product called the Household Pulse Survey in partnership with other federal agencies to help us be able to measure real-time data over the course of the pandemic about people's experiences related to COVID-19. These include factors like mental health, food scarcity, and job loss. And what's useful is that the Census Bureau has been able to introduce new questions over time as the pandemic has shifted, including questions about telework, remote schooling, and even attitudes towards the COVID-19 vaccines. So this has allowed us to create some really interesting comparisons between variables over time to really see what is impacting New Yorkers' mental health. And I do want to emphasize how exciting it is to have this kind of a data source, because data is released every 2 weeks, which really allows us to track what's happening in New York State in nearly real time. Other surveys on mental health are released on an annual basis with at least a 1-year lag. So it's great to have this resource for us to really be able to take a temperature check on the emotional well-being of New Yorkers.
Thanks for that, Sophie. So given this exciting data resource, let's get into the data a little bit. Can you describe the overall trends related to mental health in New York during the pandemic?
Sure. So we started looking at the data in May 2020, about a month and a half after the start of the pandemic. And we saw then that over 1/3 of adult New Yorkers reported symptoms of anxiety and/or depression in the prior week. And that proportion continued to increase over the course of the pandemic, reaching a really shocking proportion of 40% in February 2021. Now, since then, the proportion has steadily declined to a rate of 32% in May 2021. And this was very interesting to see because it was the first sustained decrease in reported symptoms of anxiety and depression that we saw over the course of the pandemic.
And are those levels in general during the pandemic higher than pre-pandemic levels?
That's a really good question. And unfortunately, it's somewhat difficult to answer. Because this data source was created in response to the COVID-19 pandemic, there's no good benchmark from the same data source to be able to compare whether things have dramatically increased. However, the best thing we can do is look at other data sources, even though it's not a perfect apples to apples comparison. And we do see that the rate from May 2021 is about 2 to 3 times higher than was reported in pre-pandemic periods by separate data sources. So definitely a sizable increase.
Great. Thank you for explaining that. And just, I want to dive into this a little bit with Lisa as well. But before we do that, Sophie, can you clarify a little bit of what it means to respond to these survey questions as feeling depressed and anxious relative to getting a diagnosis for clinical depression and anxiety from a doctor?
Yeah, that's a really important distinction. So the questions within the Pulse survey designed to measure symptoms of anxiety and depression are based on 2 widely used mental health screeners called the Patient Health Questionnaire and the Generalized Anxiety Disorder Scale. And certain responses to those screeners are associated with diagnoses of major depressive disorder and generalized anxiety disorder. So the results from the Pulse survey that we're talking about today indicate symptoms of anxiety and depression, but they don't necessarily represent a clinical diagnosis. That being said, even if the New Yorkers we're talking about today don't meet diagnostic criteria for mental illness, New Yorkers who are experiencing symptoms of anxiety and depression during the pandemic still require support because these symptoms negatively impact emotional well-being. So I want to keep that in mind, that even though these rates might not all have clinical significance, there is serious societal and public health significance that we need to talk about.
Thank you, Sophie. I feel like that's a good segue to get Lisa's reaction. But Lisa, before getting your perspective on the survey data, please tell us a little more detail about Vibrant and what you all do.
Thanks, Mark, and thanks, Sophie, for having me. Vibrant Emotional Health is a nonprofit organization headquartered in New York City. We serve folks locally in New York City through an array of community-based direct service programs that span the life cycle. We also operate NYC Well in the city, which is the city's 24/7 mental health and emotional support hotline that is available by phone, text, or chat. We also administer through federal funding the National Suicide Prevention Lifeline and the Disaster Distress Helpline. So we are fortunate enough to be able to work with people all across the country as well as in New York.
Thank you, Lisa, for that, and all the great work that you and your team does for NYC. But now getting back to the data, why are the trends that Sophie mentioned so concerning, even though many of these people may not be clinically diagnosed?
I think Sophie pointed us in the right direction about how to think about that. Just because something doesn't meet diagnostic criteria doesn't mean it isn't distressing to the people who are experiencing those symptoms. And there can still be a real impact in functioning and well-being. And so it is really important, as Sophie indicated, that we pay attention to the occurrence of these symptoms and look at how people are functioning and still find avenues to support them so that they can start to get back to how they want to feel and function.
Okay. Can you provide a little more insight onto why the pandemic contributes to these symptoms of anxiety and depression? And why are they so much more elevated during the pandemic than pre-pandemic times?
Sure. I mean, there were certainly a ton of just living with uncertainty and fear, particularly in the pre-vaccine era that everybody experienced. So the pandemic in and of itself would actually give rise to feelings of anxiousness and being frightened and uncertain. There are other things that happened, though, systemically and in our society that also had an impact with the advent of the pandemic. So things like social isolation, the impact of physical distancing. People lost loved ones. They themselves may have become very ill themselves and may be dealing with the implications of that. We know New Yorkers had enormous economic hardship in one way or another. Job loss has been and continues to be a real challenge. So there are a host of issues, both directly related to the public health issue of the pandemic, and then all of the things that evolved systemically and socially as a result of that.
Right. Sophie, one of the findings in the report is that many New Yorkers experiencing anxiety and depression were not able to get counseling and therapy, or said that they needed it but weren't able to get it. And we know that receiving mental health therapy was a struggle even prior to the pandemic or without a pandemic going on. But can you tell us a little bit more about how big of a problem this unmet need is or has been during the pandemic?
Sure. This is really one of the most troubling findings, I think, from the research that we conducted. We saw that in May 2021, so nearly a year and a half into the pandemic, more than 1 in 5 adult New Yorkers who reported symptoms of anxiety and/or depression also reported that they needed counseling or therapy from a mental health professional in the last month, but they didn't get it. That's 1 in 5 adult New Yorkers. And we saw that this proportion generally increased from November 2020 to March 2021. So things aren't trending in the right direction. And as you mentioned, mental health care is difficult enough to access, barring a pandemic. And there are all kinds of additional factors that make it even harder to seek care during a pandemic. Some of these things include lack of insurance coverage, especially if folks have lost employment and the associated insurance coverage. A lack of mental health providers offering telemedicine services, or even if providers offer it, lack of internet or technology on the part of patients to be able to use telemedicine, or even the lack of privacy within people's homes while they're sheltering in place to be able to use telemedicine. Also, for New Yorkers who are experiencing these symptoms for the first time, figuring out how to navigate how to get care during a pandemic is especially difficult.
Thank you, Sophie. And Lisa, do you have any other thoughts to add or insights on the types of barriers people face to receiving care, and maybe some of the lessons learned during COVID that have been helpful in overcoming some of these barriers?
Mm-hmm. So everything that Sophie said is on point. I would also add that though there is more focused attention on the role of mental health and the value of mental health supports, there still is stigma. There are people who do not feel comfortable seeking out support. They may not know how to do it, even if they want it. I also think a really big piece here is the general lack of enough linguistically and culturally competent services. That is a big barrier. And we know that the pandemic and its resultant emotional health challenges didn't affect everybody in the same way. And so what the pandemic has done is really pointed to some of the structural issues that exacerbate the difficulty in accessing care in the pandemic, but that also existed prior to the pandemic. So there aren't enough mental health services, there are broadband issues, there aren't enough culturally and linguistically competent services. It's the gamut in the way that Sophie described.
Sophie, although things seem to have been changing so quickly during the pandemic, but one of the trends that Sophie mentioned is towards the end of the study period, analyzed the rate of depression and anxiety that was being reported was decreasing. Perhaps it's going back up as it seems like the incidence of COVID is increasing again, but let's say the COVID, knock on wood, ends soon. People are able to, get back to the normal lives, more of what it looked like pre-pandemic. Would it be okay at that point to let our foot off the gas a bit and kind of assume, well, things are going to get better, and maybe these were just transitory feelings?
So I'll take that. Should we let our foot off the gas? Absolutely not. We need to keep going. What the pandemic has really laid bare is the role of mental health in recovery of all kinds, and the real challenges in getting mental health care to folks. At the same time that people are asking for care, do we have a workforce and a service system that is able to provide services to folks when and where they need it? So all this has shown us is that actually we need to put more resources into mental health care, more education, make access easier technologically and otherwise. We need to invest in culturally competent and linguistically competent services. We need to focus on disparities. So I think what we've really come to understand is, no, even if everyone were vaccinated, we still need to bolster and support and promote the mental health service system.
Thanks. Thank you, Lisa. And also thank you for mentioning disparities. I did want to transition to that topic as we received a couple of questions already from the audience on disparities and specific impacts on minority populations. Sophie, can you start us off on that and describe some of the trends by race and income that you found for the latest report?
Absolutely. So we saw some really troubling disparities by race, income, and job loss we also looked at. And in terms of race and ethnicity, we saw over the course of the pandemic that Hispanic New Yorkers were most likely to report symptoms of anxiety and/or depression relative to all other racial or ethnic groups, with a rate of 35% in May 2021. What was also really troubling was that we saw Asian New Yorkers experiencing really notable spikes in symptoms of anxiety and/or depression in May 2020 and February 2021. And a possible explanation for that trend is racist and biased coverage of the virus, which has precipitated surges in hate crimes and violence against Asian Americans. And it's really sobering to see in the data how this violence co-occurs with increases of symptoms of poor mental health. And while we've seen since February that all races and ethnicities have experienced a decline in reported symptoms of poor mental health, we still see disparities between groups. So that is absolutely something that we need to prioritize closing. And then in terms of income, we also saw that lowest income groups had the highest rates of poor mental health. And we know that income makes it even harder to be able to access mental health services. And so we really see a lot of vulnerability within that population that needs to be addressed.
Thank you, Sophie. It certainly seems to be a theme of a lot of the research that you and others at the foundation have done, in terms of COVID exacerbating disparities that have existed even pre-COVID. Lisa, can you talk a little bit how your real world, on the ground experience, how are these data reflected in the real world?
I think it is exactly this, that we saw that the pandemic disproportionately affected people of color. We know that people of color were much more likely to be frontline and essential workers and be vulnerable to job loss. These groups also experienced not just incidents of severe illness, but also lost loved ones. So the impact has been really great. And I think what this points to when we think of these disparities with regard to mental health is that, for a very long time, historically, we've seen mental health as something separate and apart from the everyday world and material existence. And what we're really seeing is that supporting people's mental health requires us to pay attention to all of the social determinants of mental health. So income, housing, education, access to healthcare and mental health care, among other things. So we can't really separate mental health from these social determinants. They influence each other greatly.
That's such a great and important point. So what can be done, to help these vulnerable populations? What more should be done to help these vulnerable populations, particularly the lower income and minority populations?
Well, I think our city-state governments, our federal government, I think those who are in the philanthropic world have an opportunity here to really focus their efforts and attention and funding towards what we're coming to understand. So addressing mental health does mean directly addressing these social determinants and changing the conditions under which they arise. And I think we need to make that explicit, that if we're alleviating income inequality, we're not just doing that, we're also boosting someone's health and well-being and their mental health. I think there are opportunities to think differently about how we develop the mental health service system. There can, for example, be public-private partnerships to expand services with a particular focus on those communities that are disadvantaged and don't have fair and equal access to mental health services. And are most affected by lack of access to care. I would also, on the philanthropic side, say that there is an opportunity to support those who are really in the trenches, who know communities and know what they need and know how to advocate for communities and what they need. I think there is often a top-down approach. We're going to provide a community with this, and it's going to improve their mental health. And I think we have to take a different approach where we support communities so that they have avenues in which to say, no, this is what we need, and to build the infrastructure based on stated needs rather than what we all might think needs to be imposed on a community.
Thank you for that. That seems like really good advice for a foundation and other philanthropic or really all organizations that are trying to help address these issues. Just to follow up on some of the things that can be done. Are there things that have happened during COVID that have been helpful at reaching the vulnerable populations that need some additional light shed on them, and perhaps might be things that can be done moving forward, or should be done more of moving forward? It's a question for Lisa.
Yeah, I think, Sophie pointed earlier to some of the challenges associated with telemental health services. Were there enough of them? Was there enough adequate technological access to broadband and so on? That being said, there was a real opening up of opportunity to provide services. The system was forced to provide them remotely as much as possible. That's something that people were advocating for a really long time pre-pandemic, was to have more of that option and have that be supported by payers, insurers, Medicaid, Medicare, and so on. So what we've seen in the pandemic is all of these challenges, but we've also seen a new modality of providing services that, for those who can access it, can really work and represents an enormous expansion of access for many people and a more flexible way of delivering services. So I think that was a silver lining, if there was one, in the pandemic, and we have a real opportunity to build on that and capitalize on that in a meaningful way.
Right. And Lisa, do you see any concerns with telemedicine as potentially, somehow further exacerbating these disparities? Or what should people be looking out for to make sure that doesn't happen?
Sure. So I think this is where infrastructure becomes super important. So we saw with the federal legislation that was being talked about that with infrastructure, broadband has to be part of it, access. I mean, even in densely populated urban communities, not everybody has the same internet access. Not everybody has access to the technologies that allow them to use telemental health. I think there is great interest in making sure that telephonic and not just video-based services qualify as services that providers can provide that should be paid for. So I think if we reduce that was offered in the pandemic and allowed, if that gets reduced, that will create more of a disparity. And the idea is that this is about creating a bigger complement of services. So as in-person services start to become safer and more in use, it's not about exchanging one for the other. It's about building an array of services that can work together to provide the service people want when and where they need it.
Thank you. Sophie, I don't know, do you want to add in anything on that, particularly for, efforts that or recent provisions that the state passed that may help?
Sure. As Lisa pointed out, we've made some really great advances in terms of accessing telemedicine. And I think where we're at right now is really making sure that we keep those advances and build upon them, that we don't backslide just because case counts might be lower than they were before, or because states of emergencies are no longer in effect. So at the very start of the pandemic, we saw several executive orders go out in New York State to lift restrictions on telehealth services. And we were really excited to see many of those made permanent in this year's state budget, which is fantastic. Some of those included expanding telehealth providers that are covered, eliminating out-of-date location requirements, and even allowing more types of staff, like substance abuse counselors, to be able to deliver these services over telehealth. But unfortunately, not everything was codified within the budget. And so we're starting to lose some of those waivers. So Lisa had mentioned the importance of having audio-only telehealth services, which allows people to be able to have a telehealth appointment just over the phone, which is very helpful for people without broadband internet who might not be able to speak over a video service with their provider. And currently, insurance coverage for audio-only telehealth services is set to expire on October 1st. in 2 short months. And that will cause disparities if people are only able to access telehealth if they have reliable broadband service. Another important thing that advocates are pushing for is payment parity. So ensuring that health providers are paid the same rate by insurers for services provided over telehealth as in-person visits. And this is really important from the supply side to make sure that providers are incentivized enough to give telehealth services. So that way we have enough for people to be able to access.
Thank you both for those for that information about what's happening in the state. And you're helping to address a lot of the questions that are coming in by the audience. And I want to encourage the audience to keep sending your great questions along. Now, Sophie, I want to move on to some other findings in your report related to the age groups. As I thought initially when I read it, the findings seemed a little bit counterintuitive, at least to the narrative that was being described early on in the pandemic. So can you discuss the age group findings?
Sure. So from the report, we saw that younger New Yorkers were the most likely of any age group to have reported symptoms of anxiety and depression. The most recent numbers from May show that 45% of adults aged 18 to 34 reported symptoms in the prior week. And I think it's easy to get number fatigue sometimes when we're going through these reports, but that represents almost half of adults in that age group. And I did also find that surprising when I was initially doing the research, especially because in the early months of the pandemic, there was a lot of attention and widespread concern that older adults in particular would experience poor mental health, in part due to their increased risk for COVID-19 mortality and also just the impact of social distancing. But research over the course of the pandemic has actually shown that older adults have reported lower rates of poor mental health than younger adults. And some of the literature shows that this may be because older adults, through wisdom of life experience, possess more resilience towards living through disasters. Also, there are fewer older adults in the workforce, so their income over the course of the pandemic was less likely to be disrupted by job loss, which we know is associated with anxiety and depression. Now, I point that out not to say that older adults don't need access to mental health services and supports, but I think it's really important that we carefully look at the data to make sure that we're really using data-driven evidence to show who is really struggling right now and use that to inform policy.
Thank you, Sophie. One thing too with those findings that seem concerning is that a lot of the improvement that was being shown in the report in the last few months of data that you had available was concentrated in the older age groups. We weren't really seeing improvement in the younger age groups. And Lisa, it would be great to get your perspective on this. Does this data match what folks in your organization and similar organizations are seeing in the field? And does any of this seem surprising or on point to you?
It actually does really seem on point. One thing to note is that older adults got access to the vaccine long before younger eligible adults. And so they may have had relief from a certain level of anxiety and fear because they could have a sort of new normal much more quickly than other groups. So in that 18 to 34-year-old group, this is the group that is still seeking education very often. They are also working, they may be parenting, and so school, work, and home are still places of challenge. If there isn't work to be had, if you're taking care of kids at home while you're working, if you're trying to further your own education, and the opportunities for doing that have been limited by the reality of remote education. All of these things, some of them are still going on. And though we're going to see changes in the fall, for example, with education, there's still the challenge of adjusting to whatever that is going to look like. So I'm not surprised to hear that this is a group that is showing more vulnerability.
Now, one age group that wasn't really addressed by the data is actually the under 18 population. And actually there were a couple of questions, about whether or not more should be done related to mental health in schools. And just wondering, Lisa, from your perspective, if you have, any thoughts on that, like, should we be like particularly concerned about, the under 18 folks and children, especially for the potential for long-term, mental health effects.
So I do think we should be paying attention to all of these issues across the life cycle. And with regard to younger folks who are younger than 18, depending on the age of that person, they may not be eligible for vaccination. They may be eligible but haven't received one as of yet. I think we can't expect folks who are school age to go back to a new normal without any adjustment related issues. They've been through a lot over the last year and a half. And has there been adequate attention to that in terms of helping them process and understand what happened and its impact? So I think those of us who provide services to kids and youth or work in schools, we're not just going to open our doors and see everything just going back to the way that it was. There will be an ongoing impact. And so it will be important to provide space and services and supports where kids are. And so it's not necessarily just about building more specialty mental health services for kids, although that is needed also. But it is providing those supports and services in the community-based programs that they're already inhabiting for other reasons in schools and other places where kids go.
I've read a little bit about more like technologically savvy services, like chat-based services. Are those, I guess, Lisa, I'd love to hear from you first, like are those effective for helping with mental health issues, particularly for children?
Yes, we actually saw at NYC Well where you could speak to a counselor using the phone or texting or chatting. What we saw with the pandemic was the most increase that we saw wasn't in the phone, it was in text and chat. And we think a lot of that, some of that may have to do with the age of the person who's using the technology, but we also think, as Sophie noted earlier, as people were sheltering in place together, privacy does become an issue. And so it does provide another way of securely accessing services without necessarily making it public. So I think that does become a very important option that people are willing to use and want to use.
Right. And Sophie, I see you nodding your head. I want to give you the chance to add in anything if you have anything. Yes.
Sure. I think incredibly important is making sure that we're providing access to children to these services. So making it clear that there are phone numbers that they can call, there are hotlines, they can access NYC Well, because while in some cases children might feel comfortable coming to their parents and navigating the healthcare system, sometimes the best option for people under the age of 18 is to seek those services themselves. And so we really want to make sure that they have access to those resources so they can, while maintaining their own privacy if they wish to.
Great, thank you for those messages. Lisa, what about another population that wasn't discussed in the report is our essential workers and frontline providers, and you mentioned them a little bit earlier. Do you have what insights should we be aware of regarding this population? Are things improving for them? Obviously in the beginning of the pandemic, these populations, particularly in New York City, were hit very hard with a lot of stress. So what's the current situation for them, and are they most at risk for potentially long-term effects?
Well, I think this is a unique group that has worked very, very hard for a very long time and was very heavy hit by an onslaught of needing to provide care and services in the community and in medical and other settings, and it was exhausting for them and very difficult. I think there is still an impact from that, even though things got better in New York State and New York City. The long-term impact will be dependent on what someone's actual experience was and how well supported they were or weren't. The disaster mental health literature does let us know that most folks experience, even when they experience completely expected, difficult, and uncomfortable emotional reactions, this is typical, it's normative for these kinds of experiences, but with the right supports, most folks will not go on to develop long-term clinically significant mental health problems. That said, the stress is real, the impact of the stress is real. We are seeing the Delta variant rise in prominence, and so I think we will continue to see distress among frontline and essential workers in the healthcare industry and in other places. And the severity of that will be, I think, dependent on how bad the pandemic is in the area and what the impact of that actually is. So I think we may see some geographic differences depending on where these workers are, whether that's in New York State and what's going on in different regions or in different regions of the country. So this is a population we still need to be paying a lot of attention to and putting our efforts to support.
And I think even building off that as well, in addition to the added risk that frontline workers have to reckon with every single day when they go into work, we've really asked them to take on so many new roles over the course of the pandemic, in addition to the thing that they are actually employed for, whether that be enforcing mask mandates or checking to make sure that patrons are vaccinated. And that's really put frontline workers at the front end of a lot of conflict and stress, which also can impact their mental health. And I think we really need to realize the variety of roles that frontline workers have really stepped into to keep society functioning on a day-to-day basis.
Thank you for those responses. And I just want we have about 8 minutes left, and I just want to send another reminder to folks to please submit any questions you may have as we wind down. Lisa, you had mentioned before, potentially positive outcome from COVID, which is that, maybe there's a little bit less of a stigma, in more ways that people could, access mental health care. I'm seeing another question here from the audience about whether or not the pandemic has helped individuals and families, come together, in any ways. Certainly people have been spending more time, at home. Is this a positive, or I don't know, were there positives in it? Sometimes families drive each other crazy. Is this, can you talk a little bit about that?
Yeah, I mean, I think we've seen the gamut of responses. I think we absolutely have seen communities come together, families come together to support each other. Resilience has played a role in the recovery that we're having and has been part of it. So yes, we certainly see that people are supporting each other. We're also seeing that, close quarters can be stressful. Unfortunately, we saw things like a rise in incidents of domestic violence, unfortunately, child abuse and maltreatment and neglect. So I think all of the things that we can think of happened, that people came together, supported each other, and found strength and comfort from each other. And stressors that were already there, or challenging or dangerous dynamics that may have already been present in a community or a family, may have gotten exacerbated by the stressors associated with the pandemic.
And I think it's important to recognize that kind of the tools that we have to mitigate our emotions and our mental health aren't equally available to all communities. So, living close to green space that's safe to navigate, where you can be outside, having walkable areas to go through, having, again, access to broadband to be able to access the outside world when you're quite literally confined at home. All of those resources aren't available to all households, and that impacts our ability to be resilient over these periods.
So we're getting some more questions about mental health issues in schools. Just love to hear thoughts from either of you on what teachers or parents can do if they feel like schools are not acknowledging the mental health needs of their students enough. Are there particular programs they should be reaching out to, organizations they should be reaching out to that may be able to help bring more awareness, to those schools?
Sophie, do you want to answer that, or?
Sure, I can start with one specific component and something we actually haven't touched on yet. But one of our findings in the report, we looked at mental health among those who are food insecure. And we found that among food insecure New Yorkers, rates of anxiety and depression were twice as high among New Yorkers who reported having enough food on a weekly basis. And granted, that was among adult New Yorkers, but I think it's a reasonable assumption that children experiencing food insecurity would also be at increased risk for poor mental health. And we've seen over the course of the pandemic that schools have played a really important part in delivering emergency meals. And so I would say that kind of maybe not the first solution we would think of, but a way to help improve the mental health of children is to make sure that food can be accessible to them within the education system. That is really a critical component of not just their nutritional health and their overall physical health, but their mental well-being. And so I think that is just another reason to add for the push for universal school lunch statewide and other food support systems within schools.
It's a great point. I would also add, to the extent that people working in the community or teachers can know about what are the resources locally near my school or near my community center where I can refer folks who, children or parents who look like they might benefit for some more supports, learning as much as we can about social emotional learning and how to support that, because whatever we can do that can help a young person, a child, to feel safe, to feel welcome, to feel like they are known in their school and other communities, that will go a long way, making those connections, letting them know that their reactions are okay and understandable, and that there are supports for them, and connecting them to those supports if it looks like they need that service.
Thank you both for those responses too. And so I think we have time for just a couple more questions, to try to pick questions that will involve shorter answers. And so one would be, are there any specific interventions that you'd like to draw people's attention to if they actually know someone who could use some mental health assistance?
So I would certainly direct folks, depending on where you are in the state. In New York City, we do have New York City Well, NYC Well. That's a 24/7 service. It's great to know that resource because anybody can call and get support. And you can call to get support for yourself if you're supporting someone else who is struggling with mental and emotional health. In New York State, more broadly, there are other resources. There is Project Hope, which is available and is a free service, as is NYC Well. And there's the National Suicide Prevention Lifeline, which is a nationwide service that anybody can access 24/7. So there certainly are points of contact that people can start to make to start getting support right away and get connected to longer term supports.
Great, thank you. And so final question, this is for both of you. Imagine you are in charge of picking the word or words that would go on a billboard that millions of New Yorkers would see. And in fact, let's not limit ourselves to New Yorkers, that all Americans would see. What would you want that billboard to say?
So many words come to mind.
I think I'll pick 3. No, 4. You are not alone. I think it's really important for us to continue the conversation that during this really exceptional time, it is normal to not be feeling normal. And as much as we can speak to our peers, we can speak to our families, we can speak to other New Yorkers about their emotional well-being right now. I think that's really, really the first step in improving everyone's mental health and recognizing that nobody does need to go against this alone.
I could not say it better than Sophie just did. So amen to that.
We'll have 2 billboards next to each other.
In different languages.
Right.
Also important.
Well, that seems like a really great note to end on. And that's about all the time we have. So thank you, Sophie and Lisa, for super informative and discussion. And thank you also to the audience for making the time to join us and to send over some very interesting questions. Before signing off, I just want to remind you all that the video recording of today's event will be available along with a link to the report Sophie described in a follow-up email. You can also find the link in the chat box right now. And you can also check the New York State Health Foundation website for a link to the recording and the reports, and also stay tuned about any for upcoming events as well. There are always things going on at the New York State Health Foundation. So thank you again, and good afternoon, everybody.